Today we'll be discussing about heart diseases in young population. We know that nowadays the heart attack and heart diseases are becoming more and more common in younger population. Specifically in Indian population, we see heart attacks 1 decade earlier compared to the Western population. Also, the presentation is more severe and the mortality is significantly higher compared to the Western population. The reasons for this early onset of heart disease or the heart disease being seen in younger population is mainly because of smoking. Smoking is one of the most important risk factors for heart diseases and heart attack. It increases the blood pressure, it decreases the good cholesterol, it increases the bad cholesterol, that is LDL cholesterol. Also, smoking does increase the risk of clotting or thrombus formation inside the body. Once we stop smoking, within a span of 2 years, the risk of having a heart attack becomes almost equivalent to that of a non-smoker. So it is very important that we advise the younger population to stop smoking. In fact, smoking, not only smoking, is the tobacco in any form, whether it is tobacco chewing or BD or cigarette, all forms of tobacco is injurious to health, predisposes for heart disease in the younger population and should be stopped as early as possible. The other risk factors for having a heart disease are sedentary lifestyle. With the more and more urbanization and mechanization of our lives, the population is becoming more and more sedentary. So sedentary lifestyle, lack of exercise eventually leads to obesity, increased weight gain, increase in cholesterol, and that itself increases the risk of having a heart disease. Also, obesity and inactivity increases the insulin resistance and increases the risk of having diabetes mellitus, which further predisposes to having a heart attack. The other risk factor for having a heart attack in younger population is diet. Improper diet, which is full of junk food, oily food, and which is rich in saturated fats, are one of the other risk factors for having a heart disease. Also, another important risk factor is the mental stress. It could be work related, it could be family related. We all know that it is proven beyond doubt that stress itself predisposes to having a heart disease or a heart attack. So a reduction of body weight and maintaining ideal body mass index is equally essential for preventing the heart diseases. The most important factor that helps is diet. We should reduce saturated fats and junk foods in our diet, increase the content of fiber, specifically fruits and vegetables. More and more quantity should be consumed every day. Reduce the salt intake to less than 5 grams per day, and at least less than 20 to 30% of our calories should be from the fats, and 30% of the calories should come from at least the proteins, and 40 to 50% should be contributed by the carbohydrate. Equally important is control of other traditional risk factors. If you have diabetes, get yourself checked regularly, control your blood sugars as advised by the doctor, check your cholesterol levels, and if required, take the medications to control the cholesterols. At the same time, if you are hypertensive, check your blood pressure regularly. You can monitor the blood pressure at your home and continue the medicines that are required to control the blood pressure. Another important thing is reduction of mental stress in our day-to-day activities. Meditation and yoga helps a lot of people to reduce the stress in our lives, whether it is professional stress or family stress. The prevention is better than cure. So controlling the risk factors, stopping smoking, adopting a healthy lifestyle and a diet, and day-to-day physical activity and exercise goes a long way in reducing the risk of heart attack.